Hello everyone, welcome to today's video on simple interrupted suturing. Let's begin. Materials that you will need include needle holder, pickup forceps, surgical scissors, curved Kelly forceps, suturing pad, surgical gloves, local anesthetic, suture, and a 10 cc syringe. Infiltration of anesthesia. Lidocaine is commonly used as the local anesthetic. To compute for safe dose that can be given to the patient, use 5 mg per kilogram or 7 mg per kilogram if given with epinephrine. Withdraw the safe dose computed from the anesthetic bottle while maintaining sterility. Sterility is observed by holding the anesthetic bottle using a non-gloved hand as shown, or by asking someone to hold the bottle for you, or by pouring the anesthetic into a sterilized medicine glass from which it can be withdrawn later. Make sure to remove any air bubbles within the syringe by tapping on it. Now that we have our anesthesia ready, we can now start to infiltrate the anesthesia. Inject with the bevel up. Once the needle is in, aspirate before injecting the anesthetic to check if any blood vessel was hit. Carefully infiltrate the subdermal layer of the skin that is adjacent to the wound and the underlying subcutaneous tissue. After a minute or two, check for the effect of local anesthetic by using the tip of the needle. Look at the facial expression of the patient to check for any signs of pain. Now we can perform the simple interrupted suturing. It is the most common technique used to close a wound. Proper handling of instruments is very important. For ringed instruments such as needle holder, properly hold them by using your ring and the thumb finger of your dominant hand in a prone position. Hold the pickup forceps in the other hand like a pencil in a pencil grip. Load the suture needle with your pickup forceps and place it at the tip of your needle holder 2/3 from the tip of the needle. Remember, never hold the needle using your hand. Start suturing by approaching one side with the needle 1 cm from the edge, perpendicular to the tissue sutured. Gentle rotation of the wrist subsequently follows until the suture exits the other surface. Adjust the length of the suture to perform the instrument tie. Instrument tie is done by alternating sides as the suture is twisted around the needle holder. Tie the knot sufficiently tight to achieve wound approximation. Position the knot at the side and not directly on the wound edge so as to not disturb the healing process. Hold your surgical scissors just like your needle holder and use it to cut the suture 1 cm from the knot. Check the tightness of the knot by widening the curved Kelly forceps with face up in between the knots. The entire procedure is repeated along the entire length of the wound. Once done, dispose waste and sharps properly and perform hand hygiene.